The pharmacy aisle looks completely normal. The product categories are there. But what actually matters is not whether the category is on the shelf. It is whether the useful version, the right formulation, the affordable generic, the age-appropriate format is still available when you reach for it. Drug shortages hit 223 active cases in the first quarter of 2026, rising for the second consecutive quarter. The real warning is not a news headline. It is an empty peg where the generic used to be. Number 11. Children's liquid ibuprofen. Walk past the ibuprofen section and everything looks fine. Adult tablets, caplets, gel caps, rows of them. But that is not what a household with a young child needs at 11 o'clock at night when a fever is climbing. The children's suspension, the 100 milligrams per 5 milliliters liquid version, is what pharmacists have specifically identified as the most vulnerable over-the-counter formulation to seasonal stockouts. And the pattern is almost clockwork. Respiratory season accelerates, demand compresses into a 2-week window, and the liquid disappears before most parents have thought to check. The signal is subtle at first. The store brand suspension goes. Then, the mid-tier generic. What remains are the premium brand name bottles at nearly double the price, and a substitution tag where the affordable version used to sit. The category is still there. The version that matters most is not. 1 or 2 bottles stored, rotated before expiration, bought in the calm weeks before the season shifts. That is all it takes. Buy what your household actually uses. But do not wait until the shelves are already thinning. Number 10. Antihistamine, generic cetirizine. This one vanishes without an announcement. There is no official FDA shortage listing for oral cetirizine right now. And that is exactly why most people miss it. No formal shortage means no warning, but localized retail stockouts driven by seasonal demand are well documented, and they follow the same timing every year. Allergy season arrives hard and fast, and the first thing to clear is the large count generic bottle, the practical format, the affordable version that households buy for the year. What stays? The 14-count name brand blister packs, the premium versions, the expensive single-dose convenience format. Meanwhile, the 365-count store brand cetirizine that sold for $8 is back-ordered online and missing from the shelf in most chain pharmacies. Here is the part most people miss. The cetirizine stockout tends to happen at the same time as a diphenhydramine demand spike. Allergy season and cold season overlap. Both the daytime antihistamine and the nighttime sleep aid version are drawing from the same compressed supply window simultaneously. When one thins, the other usually does too. A large count generic bottle bought before peak allergy season is a cheap fix. The problem is that it feels unnecessary in April and necessary in May when the shelf is already picked. Number 9. Low-dose aspirin, 81 milligrams. Nobody thinks of aspirin as the item that runs out. It is so basic, so old, so cheap, so permanent seeming that it does not cross most people's minds as a supply risk. That assumption is worth reconsidering. In January of this year, the United Kingdom added all aspirin strengths to its government export ban list after a crisis in which 86% of pharmacies reported being unable to supply it to patients. The manufacturing problem traced back to disruptions in API sourcing, the active pharmaceutical ingredients that feed generic production, from the same international suppliers that the US generic market also depends on. The upstream pressure that collapsed aspirin availability in the UK is not a UK-specific problem. It is a global supply chain signal. For millions of Americans taking daily low-dose aspirin for cardiovascular reasons on medical advice, this is not an emergency medication. It is a daily use medication. Missing a few days is not a minor inconvenience for some patients. It is a real clinical concern. That is a reason to maintain a reasonable rotating supply rather than assuming it will always be there. The shelf signal is subtle before it becomes obvious. Dispersible and chewable versions. Thin first, then store brand standard tablets, then bulk bottles. Price creep on the large containers often precedes the visible shortage. Check bulk packs for slow price increases. That is frequently where the pattern begins. Talk to a pharmacist or doctor about what makes sense for your household. Do not treat aspirin as immune to supply disruption just because it has always been available. That was also true of other items before the season shifted. Number 8. Oral rehydration salts. This one lives in a blind spot created by marketing. Walk into any pharmacy and the hydration section is enormous now. Dozens of products, bright packaging, premium electrolyte formulas designed for athletes. Recovery drinks in every flavor imaginable. The section looks well-stocked and growing. And it is, just not with the format that actually matters, when someone in the house cannot keep anything down.
The plain ORS sachet, the WHO standard rehydration formulation that is designed specifically to replace fluids and electrolytes lost to illness, diarrhea, vomiting, is being quietly crowded out. The premium sports recovery products fill the shelf space. The basic, affordable medical-grade rehydration packets are harder to find, intermittently stocked, and not prominently displayed. Here is the twist. Oral rehydration therapy is considered one of the most effective interventions on Earth for diarrheal illness. It is simple, cheap, and works. But the format that actually delivers it, the plain sachet, not the flavored workout drink, is the one being deprioritized at retail as brands chase the premium segment. A small box of plain ORS sachets costs very little and sits quietly in a cabinet until someone needs it. Pediatric flavored versions are available and worth having if there are children in the household. This is an easy fix that most households have not made yet. Number 7. Anti-diarrheal, generic loperamide. Nobody wants to think about stocking this one. That is the whole problem. It is embarrassing to buy in bulk, easy to assume it will always be available. It is ignored until the moment a GI illness hits the household hard and fast. Loperamide is the active ingredient in every store brand anti-diarrheal, all the generic Imodium equivalents. When stomach illness season compresses demand, the large count practical boxes are the first format to go. What stays? The 6-count travel packs, the expensive name brand small box, the single-dose convenience format that costs 3 times as much per dose as the bulk generic that is now gone. The deeper logic here is that loperamide and oral rehydration salts form a system. Neither one is as useful during a real GI illness episode without the other. ORS replaces the fluids being lost. Loperamide slows the process. Most households have neither one stocked in useful quantities, making illness harder to manage. 1 box of each, under $15 combined. Rotate annually. Number 6. Isopropyl alcohol, 91% concentration. Most people buy rubbing alcohol once and assume the problem is solved. It is not. The concentration matters, and the 91% version is becoming harder to find. U.S. isopropyl alcohol prices rose in late March 2026, driven by demand across pharmaceutical production, sanitizer formulas, and semiconductor cleaning. Consumer retail is the lowest priority in that supply chain. When industrial and pharmaceutical demand tightens, the first format to thin at the drugstore is the higher concentration version. 70% isopropyl is effective for surface disinfection. 91% has different applications. It evaporates faster, leaves less residue, and is preferred for certain wound care and equipment cleaning purposes. It is also the version that was consistently reported unavailable at retail drugstores even while 70% remained on the shelf. Same product name, completely different supply picture. The shelf signal is the 91% peg clearing while the 70% peg sits untouched. Bulk sizes go first. Store brand 91% goes first. What remains is a small branded bottle at a premium price. If your household uses the 91%, that is the format to watch and replenish before the trend gets more noticeable. If your household uses the 91%, that is the format to watch and replenish. Number 5. Bismuth subsalicylate, Generic Pepto-Bismol. Bismuth subsalicylate is the active ingredient in Pepto-Bismol and every generic store brand equivalent. And bismuth is not just a pharmaceutical ingredient. It is classified as a critical mineral with industrial uses in electronics, defense applications, and high-tech manufacturing. In 2025, China restricted bismuth exports. The US imports over 95% of its supply. The cheap store brand pink liquid is the format most vulnerable to the resulting supply squeeze. It treats upset stomach and nausea, but the raw material signal suggests that assumption deserves a second look. Number 4. Generic oseltamivir, Tamiflu. During the 2025 to 2026 flu season, the American Society of Health System Pharmacists listed an active shortage of oseltamivir with over 10 generic presentations in backorder. Multiple manufacturers placed the drug on seasonal allocation, meaning large chain pharmacies and hospitals got priority supply, and smaller, independent pharmacies often got less or nothing. The oral suspension form, the version used for children, was specifically identified as the most constrained. The FDA described it as localized stockouts from increased demand, which is an accurate and quietly alarming description of what a patient actually experiences. A doctor calls in the prescription. The first pharmacy is out. The second is out. By the third call, the treatment window is compressing. Oseltamivir works best when started within 72 hours of flu symptom onset. Running from pharmacy to pharmacy while sick is the wrong moment to discover a shortage. Identify options and local pharmacies before the season starts. Number 3. Epinephrine autoinjector, generic EpiPen. EpiPen and EpiPen Jr. were on backorder as of late 2025. Refill demand peaks in July and August for back to school, exactly when supply is most constrained. The specific strength matters. The EpiPen Jr. and adult EpiPen are not interchangeable. The specific manufacturer matters. When one source is backordered, the alternative brands may use different mechanisms that require practice. For a household that needs this device, arriving at back-to-school season without an in-stock refill, being handed a device they have never used from a brand they do not recognize, the week school starts. That is the consequence scene that makes this worth handling now, in June, before August arrives. Number 2. Amoxicillin, children's liquid suspension. The pediatric amoxicillin shortage of 2022 to 2023 was a warning. Approximately 47% of U.S. generic drug volume comes from India through vulnerable shipping corridors. Pediatric formulations are complex to produce and the most constrained. The liquid suspension is not interchangeable with adult capsules during an ear infection. Communicate with your pharmacist about what is in stock before you need it. Number 1. Your first aid cabinet. Complete restocking. Walk to the medicine cabinet right now and open it. Not a hypothetical cabinet, the actual one. Find the hydrogen peroxide bottle. When was it last replaced? An open bottle of hydrogen peroxide loses efficacy over time. It breaks down into water. The 3% solution that was purchased in 2022 and opened and used 3 times is not the same bottle it started as. Find the isopropyl alcohol. Is it 91% or 70%? Find the antibiotic ointment. Check the expiration date. Find the gauze pads. When were they bought? Are there enough of the right size? A household can have the right medication and still not be able to use it safely without functional first aid infrastructure underneath it. This is a maintenance visit. The calm window before fall demand is exactly now. A prepared household handles the boring weak links before they become expensive, unavailable, or urgent. That window is open today.